Assalamu alaikum. My name is Dr. Mavish, and I'm speaking today as a medical professional, a concerned Pakistani who is deeply disturbed by what I'm seeing. We are talking about health of Imran Khan, a former Prime Minister of Pakistan who is now a political prisoner. Whatever your politics, his medical care should be judged based on medicine, not politics. And when I look at his medical report, I see a clinical document that raises serious medical red flags. Let's start with his drugs, his prescription that he's been given. Why a man in his 70s already subjected to prolonged isolation is being, who was formerly fine by these reports, similar reports said that he is doing absolutely fine. All of a sudden, we hear a news that he was rushed to the medical center in the middle of the night, and now a document is released with a list of prescription where he is being prescribed an antidepressant along with Lexotanil, which is a bromazepam, 3 times a day. Lexotanil 3 milligram, also known as bromazepam, 3 times a day, is a class of benzodiazepine, which is a central nervous system depressant. It depresses your central nervous system. It can cause sedation, impaired coordination, cognitive defects. It can also lead to physical dependence. And it is also one of the leading cause of risk of fall and fractures in patients of age. This is not a harmless medication. I'm not saying that it can never be medically appropriate. I'm asking a very basic question. What is the diagnosis and who made this diagnosis? What are the clinical indications? Who suggested this dose when we have only one documented visit to the hospital? Who was he seen by at the hospital? ER doctor, a cardiologist, or a psychiatrist? How long he's being prescribed this medication and who is monitoring the intake? One visit to the hospital and all of a sudden he has a diagnosis of anxiety and palpitations. And rather than monitoring the cause of the high blood pressure, which is documented as 140 over 100, he is being prescribed drugs that are affecting his neurotransmitters or his central nervous system. Things don't add up. And when a potentially sedating medication is combined with prolonged isolation, we have to keep in consideration, could the treatment itself be contributing to sedation and further isolation? This is not a political question. This is a medical question. Now, let's look at the diagnostic picture, the diagnostic criteria. We were told about palpitations, headache, restlessness, fluctuating blood pressure, including just one reported documented blood pressure, 140 over 100, with a heart rate of 50. So the blood pressure spiked, but the heart rate remained at 50. What was his baseline blood pressure? Who is monitoring his blood pressure? What were the EKG findings? Where is the metabolic and endocrine workup to rule out any electrolyte or thyroid abnormalities? You cannot simply label potentially cardiac or neurological symptoms as stress and anxiety without properly excluding other causes. And if a psychiatric diagnosis was made, who actually made it? Was he assessed by a qualified psychiatrist or a psychologist? What standard assessment was used? A screening score alone does not establish a complete psychiatric diagnosis. As usual, his medical records, his blood work, his diagnosis, the diagnostic criteria, the protocols are all missing from these documentations. Why are the independent physicians, particularly those who are familiar with his medical history, are not being allowed to independently examine him and verify this treatment and treatment plan? So I have 3 questions. Who are these certified specialists treating or prescribing these medications? On what basis his high blood pressure is being diagnosed as anxiety and depression? What did the complete hospital workup actually show? And why can't independent physician verify this diagnosis and medications? We are not rejecting this report emotionally or politically. We are questioning it clinically. Medicine is all about evidence, diagnosis, pharmacology, monitoring, and independent clinical judgment. Medicine must never become a substitute for proper diagnosis. Medical treatment must never become a mechanism of control isolation. I'm speaking as a medical professional, as a concerned Pakistani. We do not need political explanations. We need complete medical truth. All these system flaws, all these events, all these lack of documentations are only pointing towards one direction, that they're systematically trying to break him. There is definitely something that they're trying to hide. There is definitely something happening behind the closed doors that we are not aware of. The world needs to know the truth, not as a politician, not as an ex-prime minister, but as a human being. He deserves proper medical care. Speak up, Farhan.